Have you heard rumors suggesting that the golden days of starting a nursing agency or medical staffing company are over? Are you wondering if it's still a wise investment of your time and resources? With the healthcare industry rapidly changing and being in the post-COVID environment, it's important to understand how these dynamics can impact your decision to enter this field. Many assume that the market is saturated and that the best days are behind us. My name is Carl Pierre. I'm the co-founder of Passive Workforce. I own and operate agencies generating 8 figures in revenue annually and looking to grow that company to the $100 million mark. Over the years, our consulting firm has helped launch numerous successful agencies, navigating through the regulatory challenges and the ever-changing market. Today, I'm here to share my point of view and some hard facts on the current state of the industry to help you determine if this is the right venture for you. First, let's discuss some industry basics. The first thing that you need to know is how this industry actually works. You see, what we do is we connect healthcare facilities that need staff to operate the facilities and treat patients with the staff that they need so that they're able to execute on their initiatives. Most people who are starting this sort of agency default to thinking nurses. Of course, you could staff CNAs, LBNs, LPNs, RNs, and other kind of nurse specialties. However, it just doesn't end at nursing. And that's why I always use the term medical staffing firm, because you can staff respiratory therapists, you can staff radiological imaging staff, so that's x-ray techs, MRI technologists, CT, sonography. You can staff physicians, you can staff dental hygienists. And it's not just in the hospital setting. You also have skilled nursing facilities, outpatient providers, so that could be your doctor's offices, your ambulatory surgery sites, paramedic services for fire departments, schools, daycares, summer camps. I think you get my point that you basically could staff healthcare professionals in any one of these facilities. So looking at the macros of the industry and looking at how many different facilities and providers may need staff, you obviously could carve out a slice. So when people think that there just isn't enough happening in the marketplace, you have all these facilities, all that need staff on a regular basis. Of course, there is potential for you to find your little slice of the business to help those facilities and providers meet their staffing objectives. Moving on to our second point, how is this market trending? Are we in a growth phase? Are we on the decline? What is actually happening in the healthcare industry? And when we look at the healthcare industry at large, you have to remember that the healthcare industry together combined is over $4 trillion a year of annual US spend. And this trend has been on the rise for as long as I've been operating one of these businesses, and realistically for as long as I've been alive. The main thing driving this trend of growth in the healthcare industry is mainly the population of the United States, which is also on the incline. So we have over 300 million people living here, all of them needing at some point in their life healthcare, either on a short-term acute basis or on a chronic basis. And because of that, there's just so much activity in the space. And until we have robots that could really tend to all of our healthcare needs, we're going to need people who are working in the healthcare system to help us really stay alive and stay healthy. I always recommend that people invest in one of the 5 human needs. And obviously we're discussing healthcare. So the very first that I think is a human need is healthcare, food, shelter, energy, and transportation. I feel that as long as you're catering to human needs, you'll always have someone that is looking to buy your services or be in need of your services because their life depends on it. So when it comes to whether or not the industry is growing and whether or not there is a demand for services, it's quite clear that we are on the right track as far as growth is concerned. And with that growth, you could expect continued need for healthcare staff. Now, it's important for us to talk about the money and where the industry is growing and whether or not that is also on the upswing. When it comes to the medical staffing industry itself, not the whole healthcare industry, it is a $40 billion plus industry. To be specific, as of 2022, $41.8 billion was spent on medical staffing, and that number is projected to grow out to $68.2 billion by 2030. So what that means is that over the next 6 years, the industry is expected to grow by 50%. And if you want to kind of think about business basics, this is a rising tide that is going to ultimately raise all boats that are in the industry. I'm not saying that there's going to be a direct correlation with your business if you were to start today, that it will grow by the same margin over the next 6 years. But what it's telling you is that if you're going with the flow and you're going with the current, you should see increases, you should see growth. How much growth that you experience is going to be entirely up to you. An example that I love to use to kind of drive this point home is that when you're entering an industry, you want to enter one that is projected to grow. For example, you don't want to enter the newspaper business. That business is almost extinct at this point. Obviously, social media has replaced it, and the way that advertisement has been done through social media platforms or through Google kind of has rendered the printed press obsolete. So by comparison, if you get involved in a business that is on the upswing, you really stand to benefit from that growth in that market. At some point, it'll turn over or flatline, but right now we are in a growth phase. A lot of people became interested in medical staffing because of the pandemic. During the pandemic, there was this huge demand for healthcare equipment, protective equipment, and personnel. And that was an anomaly that happened worldwide, and people saw how much money was moving around in the industry, and they wanted to jump in. If you jumped in at that time, you could have made money, but it gave a false sense of what reality actually is. If you were to look at the history of medical staffing, you would see that the need has been on an upswing. But when COVID, during the pandemic, we saw a spike in dependency on agencies, and people are fixated on that spike. However, if you look at the curve long term, that's just an anomaly that you can actually program out and still see that the industry is on an upswing. But what else is driving the industry? There's a key critical point that we often overlook, and that is that the American population is aging. And because they're aging, they're leaving the workforce. So a lot of nurses are retiring and moving out of providing bedside care, which obviously creates a void. But at the same time, that same retired nurse is aging and is also going to need services in the near future. So not only is it affecting the industry on the professional level, but you have all other professionals who are entering their golden years in a huge chunk of the American population that are going to require long-term services for longer periods of time. People are living longer, we're using more sophisticated machinery and drugs, which cost more. All of those things are additional driving factors. After examining these 4 compelling reasons why starting a nursing agency or medical staffing firm remains a strong business opportunity, it's clear that the industry still holds significant promise for entrepreneurs. Despite common misconceptions, the demand for qualified healthcare staffing solutions continues to grow, driven by an aging population and evolving healthcare needs. The landscape is ripe for new leaders who can navigate the modern challenges of healthcare staffing. At Passive Workforce, we've witnessed firsthand the success of agencies that started right here where you are. Curious and motivated, our hands-on approach has empowered many to not only start but thrive in this industry. If you're ready to take the next steps, visit our website and sign up for our premium self-directed course, which I have pinned right down below. Or if you prefer a more guided, hands-on approach, our team of experienced consultants can set you up with your agency from start to launch and handle everything in between. Don't miss out on the chance to make a meaningful impact in the healthcare industry. The time to act is now.